Hi, I'm Jasmine. I'm a level 1 nursing student, and I'm going to be shadowing you today.
Cool. My name is Lance.
Hi, nice to meet you.
Right. Yeah. So you want to turn over to SBAR?
Yeah, if you could tell me about your patient that we're taking care of today.
Sure. We got Ronald Jarvis. He's room 622, the med surg floor. He's a male, 67 years old, 171 pounds, 5'11", with a BMI of 23.9. He's a full code with no known allergies. His healthcare provider is Kay Phillips. He was admitted with his primary diagnosis of admission was a stage 2 pressure ulcer on his right heel. He has diabetes mellitus type 1. He's had for 20 years. And he came in with complaint of his glucose levels in the 300s for the last 5 days. Also, the 3-week-old non-healing ulcer. He's been insulin dependent for 20 years, but normally his glucose is around in the 120s. On his assessment, his cranial nerves 2 through 12 grossly intact. He's alert and aware times 4. The patient has qualitative defects in being able to identify the sensation of pinpricks to his bilateral lower extremities. And pain was 1 out of 10 after morphine admission. His lungs are clear to auscultation in all lobes, breathing unlabored without accessory muscle use. His cardiovascular is S1, S2 heart sounds appreciated without murmur, rub, or gallop. He has a regular rate and rhythm with no carotid bruit. His GI is the abdomen is flat, symmetrical, and soft, no tenderness, bowel sounds present, times 4 quadrants, no ascites, no bruit present. He's continent and he voids himself. His vitals, the last taken vitals didn't have a temperature. His last temperature was taken at 1550. It was 98.4 Fahrenheit. But his other latest vitals were at 1645. He had a 76 heart rate, 96 O2 sat, with a 128/70 blood pressure. The meds he's on, he takes daily in the evening Zocor 20 milligrams, 3 times a day Neurontin 600 milligrams, daily at bedtime Atlantis 18 units, which is one of the ones we'll be administering.
Okay.
Also 4 times a day regular insulin, which we'll also be administering.
Okay.
And every 4 hours PRN morphine 4 milligrams. His last AccuCheck was 2030 was 242. The one before that was 1645 was 290. So it's on the decline.
Okay.
His current lab values: he's got 141 sodium, 3.8 potassium, 104 chloride, 19 BUN, 1.0 creatinine. His glucose is 242, which is going down. His white blood count's 5,000. His hemoglobin is 14.5. His hematocrit is 41.2. His ACT is 38, and calcium is 7.4. The doctor also has scheduled another metabolic panel and CBC blood work, and those are pending.
Okay.
Patient has a 20 gauge IV in his right hand and a pressure ulcer on his right foot. And the planned interventions for this patient is pain management, diabetic teaching, wound care, and vital signs every 8 hours.
All right.
You have any questions for me?
Oh, I sure do.
Okay, great.
So you said we're going to be giving Lantus and regular insulin?
Correct.
So why is the patient getting those medications?
Well, he's a type 1 diabetic, and he's insulin dependent, and right now he has hyperglycemia, so we're administering medication to get his glucose back under control.
Okay. Makes sense. What action will the insulin have on the patient's body?
The insulin lowers the blood glucose by stimulating the glucose uptake in the skeletal muscle and fat, and it inhibits the hepatic glucose production.
Okay. So when you're giving the medication, when would you question administering it?
If the glucose was below 70, at risk of putting him into hypoglycemia, I would question giving him the insulin.
And
Also if he had an allergy to it.
okay, yeah, it makes sense. So does the medication have a therapeutic serum level?
There's no therapeutic serum level, but you definitely need to check his glucose anytime administering this medication.
Okay. And what vital signs are we going to be looking at?
You want to take his temperature, his respiratory rate, his heart rate, and his blood pressure.
Okay. And Which physiological parameters should be monitored when the medication's being administered?
You want to check for any allergic reactions in the injection site. Also, you want to monitor his vital signs every 8 hours.
Are we going to be teaching any interventions for the patient to be taking them at home?
We want to instruct the client on the proper technique for the administration of the insulin, like rotation of insulin sites, of injection sites.
Okay. And
Also include the storage and place to discard used syringes, not to change brands of insulin, and instruct the client to check his glucose daily.
okay. And what would be some side effects of the medication?
Some side effects could be like tingling in his hands, feet, or lips. He could have the chills or nausea. These are all signs of hyperglycemia.
And are any of those adverse reactions
Yes.
life-threatening?
Could be potentially be life-threatening, but they're definitely adverse reactions.
And how will you know if the medication is working, if it's effective?
If his glucose gets back in control within normal parameters, then you know it's working.
Okay. I think that's all my questions.
Cool. Let's go on.
Okay.
How you doing tonight, sir?
Doing well.
Can you tell me your name and your age?
I'm Ronald Jarvis. I'm 67 years old.
Cool. My name is Lance. I'm the nurse. This is Jasmine. She's a student nurse. She's going to be observing today. Is that okay? Is that okay, sir?
It's okay.
Okay. Okay. We have you scheduled to take regular insulin and your Lantus. So I'm going to be getting set up here. We'll do the regular insulin first. Okay, sir, I know this is repetitive, but can I get your name and your age?
Ronald Jarvis, 67 years old.
Great. So I'm checking the patient.
Let me know when you're ready. Okay, take your time.
Okay, scan the patient ID and the appropriate medication.
Yeah.
It's not wanting to scan, so I. Okay, there we go. And scan the medication. The medication is verified. I'm checking the medication. Looks clear. Expiration date's 2/20. And since he had a blood glucose of 242, that requires 16 units of this particular insulin. So let me. Is it okay if I give you this injection on your abdomen?
Yes, it is.
Okay. Can you tell me your name and your age again?
Ronald Jarvis, 67 years old.
Great.
doctors,
Trash.
diet, so, get well and,
You want to wipe the top of the
also,
vial.
we have watched, maybe you can, pick a healthy, diet,
Oh, yeah, absolutely. But it's now sending it to her.
and then, you can,
What are you doing?
I'm pulling air into the syringe because you need to inject how much air, right, as much air as medication as you're taking out.
So don't even bother putting this information in.
With insulin, you always want to get another nurse to double check. Nurse Elizabeth, could you come here and check this for me, please?
Oh, sure.
The right medication?
Yes. Yep. Yep, correct.
Thank you.
Yeah.
Subcutaneous injection, 90 degrees. Dispose it in a Sharps container. Okay. So we
Were there any pertinent pieces of information to be reviewed?
administer the time.
yes, I did, so, that's where I, found that,
25, I think it is.
Did this information affect your decision to administer the medication?
yes, because it's what the doctor has recommended, and so,
Did this information affect how you administered the medication?
no, it was,
I put in
the.
documented what time I administered medication.
Should be,
Save it.
Oh, my goodness. Yeah.
Don't forget your notes.
Yeah.
You got it.
Well, I did. This is what we put it in, right?
Yep, it backed me out of it. I'm not going to re-administer it, but the computer backed me out of it.
Yeah.
So I need to document what took place. I need to rescan it.
I'll report it now if you want. I didn't mind, but I know what we said. I'll take care of it. Where's my location again? Where's
Here's the, this is what the student nurse says.
something that the answer comes here?
Oh, yes. What's that? Oh, yeah. Okay.
Successfully saved. It showed that I gave it, now it's no longer calling for it. So now we're going to administer the Lantus, that's the long-acting insulin. Sir, I know this is repetitive, but can I get your name?
Ronald Jarvis,
And what's your age?
67 years old.
Great. And scan the med code for it. Lantus. And this shows it's a 18 unit dose of this. So,
Sure. The patient's name is Klein Ryder, room 620. He was admitted today at 1600. He's a male, age 67, no known allergies. His doctor is Dr. Phillips. His diet is 1800 calorie, diabetic restriction.
okay.
He's a full code
Get the
of Walter.
Lantus.
He's here, his main diagnosis is stage 2 diabetic ulcer, right heel, but he has a secondary diagnosis of lifelong diabetes.
The same deal, you want to
Non-smoker.
add as much air as medicine as you're taking out.
Alert oriented. His last vitals were 98.4 temp, heart rate was 80, CO2 was 95, blood pressure was 45/72, and respiration was 18. He is taking simvastatin in the evening, NPH regular insulin twice a day, gabapentin 3 times a day, and morphine PRN every 4 hours. Accu-check was down to 1645, and it was 290.
There's Elizabeth. Can I grab you
Oh,
again?
yeah.
Check this?
Okay.
Double
You
check
have,
mine.
insulin today.
Yeah, he needed 2 injections
Oh,
today.
okay.
Mostly normal.
Yeah, this is normal, so you say 16 minutes, right?
His calcium is also a little
Thank you.
low, and his KLC was 38.
Is it okay if I give you this shot on the abdomen also in a different spot?
Sure.
I'm sorry. No labored breathing, 95% on room air. S1, S2 was normal rate of rhythm.
Let it dry for a minute. You don't want to like go right after you put the alcohol on. Subcutaneous, abdomen,
He's a type 1 diabetic, so his body cannot
charge container.
so we have to give it to injections. And the insulin promotes cellular
I want to document the time.
and inhibits hepatic glucose production.
Administration route, the 16 units or 18 units
Like glucose, I'm sorry, if it's below 70, you don't want to
in abdomen.
you want to check for allergies and also to monitor all that. No.
And which physiological parameters should be monitored when the medication is being
You want to make sure that
And my initials.
What intervention
CO. Save. Okay, now all his medication has been administered that he's called for. You scroll down tomorrow, it doesn't show that he has any other medications coming up. Okay, is there any questions you have about this medication, sir?
I don't have any questions about the medication, but I have some questions about the diet, diabetic diet.
I saw the notes that you wanted to know more about the diabetic diet, and I had printed out this information for you to go over about the diet that you can look over at your leisure. And the next time I come in, if you have questions, we can talk about it and go over it.
Okay, thank you so much.
Thank you. You have a great night.
Thank you, you too.
So is there any other questions you have for me?
I do. Were there any pertinent pieces of information you reviewed before administering those meds?
Definitely. Glucose that was measured at 20/30 is very important because, like I said, had he had a low glucose and you administer it, he could go into hypoglycemia and it could be really bad.
Okay. And so you checked those. Did that information affect your decision to administer the medication?
Definitely. It was very high, so he definitely needed to make the medication.
And did this information affect how you administer the medication?
No, the doctor's orders and the dose and the route were all acceptable, so there was nothing. Great,
Yeah, you're a great teacher, thank you.
thank you. Now I'll finish documenting everything and move on to the next patient.